what impact does the robot have on our community is actually huge. By that technology, they're able to perform complex surgeries more effectively with less morbidity. That is, the patients recover faster.
Sure.
And the surgery is more accurate, and so the recurrences are less. They need to make less trips to the operating room. The quality of life, once again, for that patient who had that surgery is much higher.
It also means that people aren't leaving the region, because previously people who wanted robotic surgery were leaving and having to drive down to Toronto and getting the surgery there and having to follow up with the surgeon in Toronto. So that's
such an important
It's a lot less time on the 401.
Welcome to Brace for Impact, the podcast sharing stories about patient care, the incredible medical professionals at Lakeridge Health, and the impact fundraising is having on our hospitals. Dr. Samir Chhabra is the Deputy Director of Surgery and the Division Head of Orthopedics, and Dr. Ernest Chen is a urologist and the Urology Robotics Lead. What was attractive about Lakeridge in particular?
My goal was always to find a kind of community-based urology practice with a focus in robotics, where I was able to provide a full breadth of urological care and not be pigeonholed into something, but also have access to surgical robotics where I can perform really high-tech, minimally invasive surgery that benefits patients. So those jobs weren't plenty because of the limitations of acquiring a robot. And when this position opened up, it was really just a perfect fit for me. It was close to where I want to live, access to surgical technology that I was trained in, and there was a purpose behind the job that I was really excited to fulfill.
Yeah.
Also, you've got fantastic colleagues.
Yeah, no, the colleagues are awesome. So
A little pat on the back here, yeah?
yeah.
Excellent colleagues in the urology department, Lakeridge Health. We're very proud of them.
Yeah. Samir, I'm hoping you can talk as kind of the head honcho around here. What is the breadth of services you offer? Because you've got the surgical robot, there are other things going on, but generally speaking, what can people expect to find here?
It's indeed a privilege to be in an institute that provides such comprehensive care. Our Department of Surgery includes general surgery, who perform bowel surgery, breast surgery, cancers. And then we've got a very busy orthopedic service, which provides joint replacement care and acute care, trauma care, fracture management. And in the province, we are one of the leading hospitals for hip fracture management.
So if you're going to break your hip here, this is the place to do it.
This is the place
Move
to
to
do
Durham region, then break your hip.
You'll be
Yeah.
you'll be done on time and you'll be done well.
Yeah.
And then we've got a urology department, and we've got bright people like Ernest working in that department.
You don't want to break those parts, right?
No, you definitely don't, but we can fix them too.
Yeah, it's good to know.
And then a full-fledged plastic surgery department and an ophthalmology department, which does a high volume of cataract surgery, which is a big need in our community. And then ENT, that is ear, nose, and throat, which is now called otolaryngology.
Oh, it got rebranded.
Well, yes,
I must have missed the press release. When did that happen? When did we rebrand?
It happened a few years ago
Okay.
because they wanted to make the terminology more comprehensive to what they perform.
A little more inclusive.
Oh, yes,
Yeah.
of course. And then a thoracic department, we are privileged to have them. They offer a highly specialized service, and they're the center for thoracic surgery in our area.
Gynae and
Gynae
gynae
and gynae oncology, yes.
They got a whole episode on their own.
No. Integral part of our department. And to support them all is a fantastic anesthesia department who are highly specialized in dealing all kinds of complex cases.
Those doctors are a ton of fun. You know?
Yeah.
They're party people, right? They're bringing the good vibes.
Really?
I mean, listen, as long as you're knocked out for these surgeries, that's a good time for me.
That's
It's a good
right.
time as far as I'm concerned.
As far as we are concerned, they make our operations safe. And anybody who comes to Durham can be assured that their surgery is going to be performed by extremely well qualified anesthesiologists so that their operations go well.
Yeah. Now, you both have been here for different periods of time.
Yeah.
Samir, you've been here for 20
I've been
years.
here for 20 years, yeah.
Ernest, you've been here for 3. I want to talk about how surgery has changed over the course of your respective careers. I'm imagining, Ernest, it's changed, maybe not as much, Samir, as it's changed for you, but During your 20 years at this facility, what are the evolutions you've experienced?
Well, I've seen not only Department of Surgery at Lakeridge Health evolve, but also learned in my own profession as an orthopedic surgeon how care has evolved. And to highlight, I could divide that into two broad categories. First of all, in our diagnostic capability, we made major strides. We now have innovative technology to help us identify problems, such as using CT scans and MRIs. And you may say, well, these existed even 20 years ago. But the quality of imaging has improved considerably. And what that allows us to do is to make a diagnosis more accurately. We operate when we know exactly what is wrong, and that allows more precision surgery. As far as treatment is concerned, we've improved considerably. We've got state-of-the-art equipment in our hospital so that we can deliver high-quality care, which is up to date with what current medical technology is. And examples of that include robotic surgery, which Ernest is going to talk about, but laparoscopic, arthroscopic surgery, which is commonly called minimally invasive surgery. And improved technology allows us to do that. We are also venturing into robotic surgery in orthopedics, and we're going to talk more about that. And so with both the diagnostic capability and improved surgical technology, we now can deliver on our mission, which is to empower patients to lead the best health.
And eventually to do their own surgeries, right? You hand them the joystick and they're good to go.
What are we going to do then? Come on,
It's like
guys.
self-checkouts. They're taking over everywhere.
Wrong person. He needs to keep quiet.
Speaking of the Da Vinci surgical robot, this is speeding up recovery for patients. It's making the whole system, it's making the whole experience a lot easier. How does this fit into your day-to-day life as a urologist?
The way our group works is for all patients that are eligible or should be undergoing robotic surgery, primarily like a radical prostatectomy or a partial nephrectomy, they get referred to myself or Dr. Sammy, who are trained to perform these surgeries. So a lot of our practice is about kind of identifying the right patient, counseling about that surgery, and then performing that surgery, which is why part of that diagnostic imaging component is really important, because it helps us not only visualize what we're going to be taking on, but identifying the right patients for candidacy and seeing who should or shouldn't be having surgery. So I think that the imaging component is really underrated. In terms of how this affects my day-to-day, I'm really passionate about robotics and performing minimally invasive surgery. I get really excited about it. I spend a lot of time doing extra training on it, reviewing videos.
Why is it exciting for you?
Because it's cool,
Yeah.
right? Like,
You know, good answer.
the
Good answer,
opportunity,
because
like,
it's cool.
opportunity to explain to patients that we're gonna, use keyholes, but deploy telescopic robotic instruments inside of you. We can visualize things in 3 dimensions. We've got multiple angles of articulation. We can even deploy an intraoperative ultrasound to help map out a tumor, so our surgery can be more precise, so that you can have better care.
Yeah.
We can take on your surgery. We can make sure that you're cancer-free and that you're going to have a really good outcome from it and be relatively pain-free and be able to return to your kind of normal quality of life after.
What does the conversation look like with, or I guess sound like, when you're counseling patients? Because maybe you've heard news stories about this, maybe you've watched a podcast episode about this, but when you hear robotic surgery, like, I think the human instinct is to feel a little bit reserved or a little bit nervous about that. How do you explain the service? How do you explain the procedure to patients?
So the way I explain it is a surgical robot. It's a tool. Like any other tool or instrument, it's under my control at all times. So I'm just using the equipment as a tool to help provide the surgery in a more precise and minimally invasive way. And I think that reassures patients. I don't want anyone to come away thinking that it's an automated robot and there's some kind of AI tool that's performing the surgery.
You're out having a coffee break in the parking lot. You press a button, it's good to go.
Exactly.
What about with robotic-assisted joint replacements? Those are becoming, we have an aging population. Durham region is the fastest growing community in the entire country. People break, right? Your parts get a little bit old. You need a replacement once in a while. How has that affected, having the robot, how has that affected joint replacement surgery in general in Durham?
So to pick on Ernest's point, I need to stress that the robot is a sophisticated tool and not an automated device that you press go and does the operation. No. What the robot does for orthopedics is that it improves our ability to implant a joint more precisely. And by that, what I mean is that the robot is an arm which holds on to the saw but is in the control of the surgeon, holds the drill, and all the robot does is guides that equipment so that we do the operation properly and accurately.
Kind of like Avatar, right? You're in like a pod
Exactly
and
right.
you're moving it.
You got that right. And so what happens is that we map that joint pre-operatively, that is before the operation, by a CT scan. And so the machine now has a really good idea as to what the joint inside is, and then decides based on our instructions, how do we make a bone cuts so that we can fit the prosthesis accurately. We do the opening of the operation, and then the robot comes into play, and then it guides the saw or the drill to then make the bone cuts so that we can then re-implant that implant ourselves. After the surgery, what we find is that the accuracy of implantation is high. It is standardized. Whether you're an experienced surgeon or a younger surgeon who's just starting his career, their accuracy is more or less going to be similar.
Yeah.
And so it takes out that unpredictability of accuracy out
It
of the equation.
standardizes it across multiple surgeons.
That's
Yeah.
right. That's right. And so the joint will ultimately go where it needs to be. And so that's the big benefit.
And it's got haptic feedback, I think.
That
now,
is
right?
exactly
Yeah,
right.
yeah, yeah.
Yes. You're familiar with what haptic
So-
feedback is?
Like I said, we did an episode about this 2 years ago. So actually, I'm curious. In the 2 years since we recorded it was an episode about robotic surgery, and we had two wonderful gynecological oncologists, Dr. Igwe and Dr. Julianne Francis, who, side note, gave my wife a cervical screening a couple of weeks ago. They had a pop-up, and my wife said it was the best cervical screening she'd ever had. So shout out to Dr. Julianne Francis. But in the 2 years since we recorded that, what, if any, changes have we seen with the Da Vinci robot?
So once again, the haptic control, for those people who are not aware of what that means, is that the saw gives the surgeon's hand feedback when the equipment is creating the bone cut. And if it veers off the safe corridor means where it needs to make that cut, it will actually stop.
Kind of like when you're driving and you veer off into the lane a little bit and your vehicle kind of
You just
self-corrects
feel-
or vibrates. Yeah.
But how about if it just stopped you
Yeah.
right there?
Sometimes my car tells me to take a break, and I'm like, don't tell me what to do.
Yeah.
I'm the human. I'm the one driving this thing.
This time the robot stops working.
Yeah. It's probably for the
It just switches
probably
off.
for the best.
It just switches off the saw
Yeah.
and says, no, you're not going there.
What other kind of opportunities do you two, Ernest, I'll start with you, think that that robotic surgery, what kind of future opportunities in Durham do you think we'll see?
Well, I think, the surgical robot that we have here in Oshawa is the most highly utilized robot in the whole country. I think we do more cases per robot than any other hospital. And I think that's been identified in
Can I
our
add to that?
statistics.
1,000 cases done on the robot, and this is the highest in a center with one robot.
Damn.
And it's completely saturated. So I think one of the things that we're looking for is maybe even expanding to have a second robotic unit to help provide with additional opportunities, expanding the types of surgeries or breadths of surgeries that we can perform. So, for example, in urology, while we can do radical prostatectomies for prostate cancer and partial nephrectomies for kidney cancer, but there are other surgeries that we can perform, reconstructive surgeries, different types of oncology cases. But as it stands, despite having the volume for this, we just don't have the capacity to take these cases on due to kind of just availability, right?
I'm sure it's not as simple as one issue, but is it partially maybe a space issue? Is it partially like a funding issue? What are the barriers between you having one surgical robot and you having, let's say, a second surgical robot?
So right now, our surgical robot's used by 5 different services. So urology, general surgery, thoracic surgery, benign gynecology, and gynecologic oncology. So those 5 services take up the 5 working days of the week. So we only have the ability to use a robot once a week per service, which means that we can only put through a certain volume of cases per year.
What day of the week do you guys get?
I'm on Wednesday.
Do you like Wednesday?
I like Wednesday. It's the middle
It's
of the
hump
week.
day.
It's hump
Yeah.
day, right?
Yeah.
Now, if we had a second robot, then we could potentially do twice the amount of surgery.
What other day of the week do you want? You got Wednesday. You want Friday? You want Monday?
Probably Tuesday.
What about as we see, potentially a second surgical robot come in? What other applications do you think we'll see for this thing?
So obviously, as Ernest indicated, the general surgeons use the robot all the time, and so their scope of practice is huge. And so obviously, if the availability of the robot is there, they're going to expand their indications more than what they've been doing now. The gynecology oncology department is also growing. They're hiring more surgeons, and so their need is going to increase. And as you can appreciate, a lot of these surgeries are cancer surgeries, and so they need to be performed within the appropriate time.
Yeah, which can be pretty quickly sometimes.
And so match that where you're given 1 day a week, and now you've got a backlog of even a few more cases, then that means those patients are waiting longer.
Yeah.
Now, to answer your question in greater detail with regards to what impact does the robot have on our community is actually huge. Because by that technology, they're able to perform complex surgeries more effectively with less morbidity. That is, the patients recover faster.
Sure.
And the surgery is more accurate, and so the recurrences are less. So they need to make less trips to the operating room. And so the quality of life, once again, for that patient who had that surgery is much higher.
It also means that people aren't leaving the region, because previously people who wanted robotic surgery were leaving and having to drive down to Toronto and getting the surgery there and having to follow up with the surgeon in Toronto. So
That's such an important
It's a
point.
lot less time on the 401.
Well, especially when you're sick. Like I'm celebrating 5 years remission this summer. Before Durham Region got a PET CT scanner, I'd have to schlep into the city. I was 29 when I was diagnosed. I was younger. I was aside from the cancer, relatively good shape. And I had childcare, and my wife worked from home, and we were able to make it work. A lot of people, though, might not be able to make it to their appointments, and that's just imaging. When it comes to surgery, I'm not going and getting scanned and all of a sudden, I'm immobile for a couple of weeks afterwards while I recover. When you're getting surgery, that might be the case, especially for older folks. So I really appreciate the fact that you brought that up, that it's easier for people. They're not leaving the region, and that means that they're probably more likely to even opt for surgery in the first place.
Absolutely right.
I think it's multifaceted too. Not only are you seeing a surgeon that's local to you, you're getting a surgery at your local hospital. You're being connected with home care services or, regional nursing services that are local to your region. And then your follow-up appointments. And even if something happens, you end up in an urgent care and emergency department, all of your health data is available here.
Yeah.
So you're getting all your care closer to home, and it's more streamlined.
And there's something to be said about people who work here. My daughters were born at this hospital. We've got a large number of staff who not only work here but live in the area. We feel good about a hospital that provides comprehensive care. I feel confident that I'm going to come here to this hospital to get care for myself and my family.
Yeah.
And the more services we can offer locally, it's a feel-good factor.
You're
for
taking
the
care of your
staff.
neighbors.
Exactly.
Yeah.
And there's something to be said about that.
It's like the person who runs a restaurant that doesn't eat at that restaurant. And you're like, well, why not? What's going on in the kitchen? What's up back
Exactly.
there?
And so, I'm quite proud to say that a number of people who work here, they've been our patients in the past, and then they come back to treat other people. And when patients come in, they often share their stories. Even I got this done, and I was operated here, and look at me now.
Yeah.
And suddenly the patient feels differently.
It is funny to think of a patient laying back and going, nah, I could do that. And then they go to school and they start working here afterwards, prove themselves right.
So, it takes, we're very proud to take care of our own people here as well.
Yeah.
And I think it's a great feel-good factor for us
Yeah.
as staff to do that.
Well, let's talk about attracting talent. I mean, Ernest, you mentioned that one of the big reasons you came to this community, you wanted to live here. Yes, the staff is great, but the technological advancements, which are, at least in the Da Vinci surgical robot case, it's donor funded. We talk about the community taking care of ourselves and making sure we're supporting our neighbors. That's something that the community funded, and that's, I think, a big reason why you're here.
Yeah, I mean, we all want to work where can find good colleagues and a good group to work with. You want to be able to provide a high quality of care as well, and you want to be able to do the things that you're passionate about and what you're trained to do. And in my training, I want to do robotic surgery, so having access to that was a really big pull factor for me.
Yeah. Can we talk about the technology and these cutting edge programs specifically?
Yeah.
Like we're talking about people staying in the community.
Yes.
But attracting people to work here is equally as important.
It is very important, in fact. And what I want to highlight and express our gratitude to the foundations that they've helped us keep up with technology. Without this backing of the foundation, we wouldn't be where we are with any of this modern technology we've spoken about. The Da Vinci robot, the orthopedic robots, which are soon to arrive. And also, Ernest would speak about the ultrasound technology, which is absolutely cool.
Yeah.
Intraoperative use of the ultrasound, that is phenomenal. And so the point is that in the university hospitals, which are very well funded, they have this technology and the younger surgeons get trained on that. But if you look at it through another angle, they don't know the archaic techniques which older surgeons did.
Yeah. To be fair, you are still using fax machines every day. So, there is still a little bit of archaic
digital
technology.
Fax, though. It's digital fax.
Still fax.
We're getting better. We're getting better. Anyway, so the point is that when they come out to the community, they're looking for hospitals which have a setup which they're familiar with, on which they've trained. They don't want to go retro now.
Yeah.
And so when we provide technology, the surgeons like Ernest are actually looking for something that a community hospital will provide. You'll be surprised how there are so many community hospitals not privileged enough to have any of this equipment.
Yeah.
And once again, we are highly indebted to the foundations who support our practice, who understand the need to be in touch, to keep up with innovation, and then fund that at the right time.
Can you talk about the importance of working with the foundation and community members in general, opening their hearts and opening their wallets as well, and gifting and making sure that we've got access to these amazing things in our own community?
I can't speak enough about this. The community is so hugely supportive to all our programs. They clearly follow due process, which involves us submitting an application to saying what we really need, and through their due diligence, which consists of actually speaking to the community and finding out what they need, and then coming back to us with funding in such good time, truly is a huge impact. And I do not know how they do that, but I think the foundation does an amazing job in their fundraising activities like the gala and the golf, so they make it fun. And I've actually met some of the donors, and I can say that they are so committed to the region and they're so committed to good health in our community that without that support, I can tell you we'd be nowhere for Department of Surgery.
Ernest, can you talk about maybe the pride that you feel knowing that so many of the patients you're serving and so many of their caretakers and people in general in the community, individuals, corporations that are funding a lot of these things? Like, that's got to make you feel pretty cool.
Absolutely. So I'm very proud to be working here at Lakeridge Health. And I didn't know it at first, but this is really a very strong community. It's a tight-knit community. And this is a hospital that has a lot of stuff. Not only do we have a surgical robot, we've got access to CT, MRI,
Pretty good
a
food
PET
court.
scanner, a pretty good food court.
Not funded by the foundation.
No.
Regional Cancer Center. So when I speak to some of my colleagues about the equipment that I have access to, the stuff that I get to do on a day-to-day basis, I feel very fortunate. So I'm absolutely very proud to be have the opportunity to work here. and build a career here.
And for the investigation side, the CT and MR, get this. This is a real great story. So everybody knows that MRI scans take a long time. And each scan can take up to 35 to 40 minutes.
Yeah, and you can't move, and it's like it's very claustrophobic.
Thank you. It is claustrophobic, and they keep announcing, stop moving, stop moving, so that...
We know you're farting in there. We can smell it.
So they've got this new software which cuts the time down to almost 10 to 15 minutes.
Nice.
You can't believe this.
Yeah.
And so one of Ernest Chan's colleague, Dr. Arun Mathur, approached the foundation to say that, listen, if you all funded this software, it would cut down the cut down the MRI time by 1/3.
Which means a third more patients.
Thank you.
It benefits everybody.
It benefits everybody. The long waits for MRI, and so the foundation went ahead and said, no problem, we'll sponsor this. And I think, how much was it? I think 300,000.
We need to get into the software business. That's if you take away one thing, it's that invest in the three of us. We've got some software, and it's 290 grand. So,
but do you believe this? That they funded that upgrade, and now MRIs are going to be done so much faster.
Yeah.
And so, to Ernest's point, suddenly this all helps so much to patient care, right? In so many ways.
yeah.
Less wait time, more accurate diagnosis, better equipment.
I really appreciate your time, both of you, today. Before we depart, I want to give each of you an opportunity to speak to the community. We're super thankful for all the funding, and we're super thankful to the foundation for allocating those dollars in the best possible way to make sure that we've got the best possible care here. Samir, I'll give you a chance first. Hop on your soapbox. What do you want to say? What's the message you want to leave people with today?
So, for myself and my family, I'd say it's a privilege to be working in an organization that is committed to healthcare, not so much as an institute that just simply delivers care, but looks after people as a family, where family members are supporting the family to live a better life. And that's what our goal is. That's what our mission is. Our values are centered around innovation, which the foundation supports, compassion, so that we can understand care for our patients, joy, because it gives us great pleasure, as Ernest had indicated. It makes us happy when we can do a job well. And so when you embody the values that your organization prides on, it makes us happy as individuals. Agreed that it feeds our family, but job satisfaction is essential. And I can say that I've worked with the foundation now for so many years, and it's an absolute pleasure to work on projects. Sometimes it's a struggle, but the outcome, more often than not, is all good.
Yeah, I love that.
And so I'm really very happy to be here.
Yeah, I'm happy you're here too. Ernest, what about you? What do you want to leave people with today?
I'm not sure how I follow that, Samir. That's a big one. But
He's like, ditto. Thanks so much. It's been great.
I got to say, it's such a privilege to work here. I'm really happy to come to work every day. And I think what I want the community and people to know that is that donations to the foundation, like Lakeridge Health, really go a long way. And I think it provides individuals like me with an opportunity to do what I'm passionate about, provide really high quality of care. And I've really felt like I've had the opportunity to start a lot of different programs, robotic prostatectomy program, a partial nephrectomy program, and provide a lot of important impact to patients and improve their care. And it's really been supported by everyone here at the hospital. So I think that without the foundation and without the support from the community, that wouldn't have been possible. And I think it's going to go on to help recruit bright minds, allow us to continue to develop innovative and patient-centered programs, and continue to support the community.
Amazing. Guys, really appreciate that. Thanks so much for your time today. Thank you.
Thank you so much.
Thanks to Dr. Samir Chhabra and Dr. Ernest Chan for joining us on Brace for Impact, presented by Lakeridge Health Foundation. Brace for Impact wants to give you a sneak peek behind-the-scenes look at how donor support makes all of this amazing work possible. We want to inspire and motivate you to make a difference in your own way, because it's people like you who are making a difference in this community. My name is Colter Bouchard. Join me by giving or getting involved at braceforimpactpod.ca.